Alright, in this video we are going to cover the rest of the upper divisions of the respiratory system. In the previous video I went over the functions of the respiratory system and then talked about the differences between the divisions. Basically, the upper division of the respiratory system contains the nose, the pharynx, and then the larynx, and then the lower divisions would be the trachea, and then not seen in this picture would be the losing my mind. Yeah, the bronchi and the lungs. The bronchi and the lungs. And in the previous video, I talked about the functional aspects of the nose, some basic anatomic structures that play a role in the functional aspect of the nose. And in this video, I was starting to run out of time. I was getting to be almost a 50-minute talk. So I decided to stop there. And in this video, we're going to cover the pharynx and the larynx, and then I will jump into the lower divisions of the respiratory system in a third video. So on that note, let's get rolling. So the pharynx basically is kind of a hollow. Oops, dropped my pen. Sorry. The pharynx is kind of a hollow, kind of like a tube-shaped structure that basically connects the mouth and the nose together and then carries air, food, and water down towards the respective passageways that it needs to travel down. Food and water need to go down the esophagus towards the stomach to be processed. To continue the process of digestion, not begin, but continue, because digestion begins in the mouth. And then air is carried down into the the lungs through the trachea. All right, and we'll talk about how those two are separated when we talk about the larynx. But like I said, the pharynx basically is just a passageway to bring air, food, and water down towards the tubes that we need to transport them down into. And the pharynx basically consists of three functional divisions: the nasopharynx, the oropharynx, and the laryngopharynx, all right, which is basically the beginning of the larynx, or the hollow part of or essentially is the larynx itself. All right. So let's kind of talk about these when we talk about with pictures instead of just words. So the nasopharynx, this is the only portion of the pharynx that's going to contain that ciliated, that ciliated epithelial tissue, those ciliated columnar cells, essentially, that have a mucous membrane to it. All right, and also this is probably the busiest part of the pharynx because there are many openings. Basically, with the pharynx, there's essentially 5 different openings here. On each side, you've got basically as air moves through each nostril into the nasal pharynx, basically, so that's 2 openings right there. And then right here, this is the opening of what's called the eustachian tube. Talk about that in a second. And then basically you've got the opening of the oropharynx right here. So we've got 5 separate openings or passageways through the nasal pharynx. All right, we already talked about the processing and filtering of air in the nose, so I'm not going to talk about that in this video. But let's talk about the eustachian tube here for a second. The eustachian tube basically is what connects the nose to the ears, more specifically the middle ears. So basically this is a hollow tube that basically allows for the passage of air between the middle ear and the nose. And the purpose of this is for pressure regulation. All right, so remember, if you take a look at, oh boy, I'm going to attempt to draw an ear here. So if you take a look at an ear, hopefully ears don't look like this. Basically, you've got the outer ear, and then air passes through the ear canal, which is kind of the end of the outer ear, and it hits your tympanic membrane. And then you've got your middle ear, where you've got the auditory ossicles. All right, as air hits the tympanic membrane, i.e. the eardrum, it vibrates. And then those ossicles basically mechanically press on basically on the fluid contained within the cochlea of the inner ear, and that those mechanical fluid vibrations allow us to sense to begin the process of detecting sounds. But basically, there's a this cavity is a hollow space here, right? And the tympanic membrane is a very thin, soft piece of tissue that's highly innervated and also highly vascular. All right, so it's very sensitive to pressure changes either externally or internally. All right, and I mean, picture this for a second. Let's say, remember a time you've gone swimming and you've gone down. Let's say you've gone to the deep end of a pool and went down to the bottom, like a 12-foot pool, or you go to a lake or you go diving. You just go down as far as you can, and you just start to feel that pressure build up in your ears. What was happening is that that water pressure is essentially putting an inward pressure up against your tympanic membrane, right? And then, well, what's your natural response? You close your mouth, you take a hand, plug your nose, and you just start blowing really hard, except you're not actually blowing any air out. What you're essentially doing is you're forcing air because the opening to the eustachian tube is covered very thinly by a flap of epithelial tissue, and what you're doing when you're blowing that air up like that is you're forcing that flap to open, you're forcing air into the eustachian tube, so you build up air within the middle ear to prevent all that pressure from basically collapsing, tearing the eardrum. All right, and then vice versa, when you're up in a plane and the air pressure is a lot lower outside your body and the pressure in the middle ear is greater, that's why they tell you to chew gum or chew on something, gum you just chew on for longer, and you hear you hear those kind of snapping sounds inside your in your ears. What's happening? Those snapping sounds, those are little bursts of air kind of going psst, 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 out of your middle ear to balance out the air pressure around the tympanic membrane. And that's why, for example, when you hear about little kids when they rupture their eardrums, remember this eustachian tube is a lot more horizontal when we're kids, and then as we grow and become adults, it becomes more vertical. It's not completely vertical, but a lot more than when we're younger. So if you have an upper respiratory infection, and then you have a bunch of fluid and mucus building up in that eustachian tube, it's going to be a lot harder to drain those fluids out of there. And then as a result, you're not going to be able to balance out the pressure around the eardrum, and that's when kids get those splitting headaches. And then if the eardrum actually does rupture, what's going to happen is, if it basically when it ruptures, it tears. You're going to start seeing bleeding out of the ear. I mean, it's not going to be like massive hemorrhaging, but you will see blood coming out of the ear. That's why they go in. That's why they go in and they basically take a hollow tube and they put a small hollow tube, make an incision in the eardrum, place that tube in there, because that just allows for free airflow between the outer and middle ear and prevents the eardrum from rupturing. And then eventually the little tube will just fall out. And then you just take it out. The infection's gone. That's why you really don't hear about this problem with adults, because, like I said, as the eustachian tube becomes more vertical, it's just easier for fluids to drain out, and like I said, we can maintain pressure pretty well. All right, and so that essentially is the job of the nasopharynx. It does play a role in balancing air pressure with the eardrum, and then, like I said, it receives air from basically that pass through those meatuses between those conical bones, and then remember that pharyngeal tonsils right here. So we continue to filter air in the nasopharynx, and then eventually it's going to take a 90-degree turn and head down. All right, and then basically we've got and then basically the next part of the pharynx would be the oropharynx, and basically the opening from the mouth to the throat. That's what's called the fauces. All right, this part right here, the fauces. And remember that the oropharynx is different in the fact that it contains non-keratinized stratified squamous epithelial tissue. So what that tells you is that it's not designed for filtering. So if you're mouth breathing, if you're breathing in a heavy amount of air through your mouth, right, your mouth really isn't going to filter that air very well, and neither is the oropharynx. All right, so it's something you have to keep in mind. And then basically we're eventually going to get to the laryngopharynx, and then that laryngopharynx, the upper part of the laryngopharynx, is also non-keratinized stratified squamous epithelial tissue. So that really doesn't play much of a role in filtering either. As we get deeper into the pharynx, or basically into the larynx, basically below the glottis, the opening of the larynx, then you're going to start getting that you're going to start seeing those mucous membranes reappear again. All right, but that essentially is all the pharynx is all about. It's just a connecting tube that allows us to transport air, food, and water down towards, we want air to go into the larynx and then down the trachea, and then we want food and water to go down to the esophagus. That's why, for example, if you're drinking a can of soda and somebody laughs, and you start laughing while you're taking a drink, and that soda goes flying out of the nose. Um, that's which is just it's awesome when you see it happen. It's just not very cool when you're the one that's actually happening too. Oh man, I had a buddy of mine once in college. I can't remember what I did. I think I might have passed gas or something, but or told a joke. I can't remember, one of the two. But he was drinking a soda right at the same time, and when I think I said something funny with that situation. And I've never seen so much soda come out of somebody's nose in my life. It was awesome. And then, yeah, it reminded me another time. I remember this. They're having this. We had a big corn roast. We were roasting corn out at the. It was up at Wisconsin Point along Lake Superior, up in the northwest side of Wisconsin, and we were all standing by. We were eating corn and just hanging out at night because you can build bonfires on the beaches in Wisconsin, and at least you could at that time. I don't know if you can anymore. And just as this dude was, this buddy of mine was to just had this big mouthful of corn. I remember I cut the cheese and corn started flying out of his nose. That was the funniest thing I ever saw in my life. So, but that essentially is why people can, cough things out of their nose that they put in through their mouth, or run spaghetti noodles through their mouth or nose or whatnot. But like I said, think about that. That's functionally that's important because, like I said, if we ever get sick and we build up if we have a thick mucus build up in our nose and we have a difficult time breathing through our nose, it's nice to be able to breathe through our mouth. However, that's not something we want to do for very long because remember, your mouth doesn't process air like the nose does. All right. So, yeah, so actually, I forgot about some of those stories. So, actually, this lecture kind of brought back some good memories. Sweet. All right. So, that's really all the pharynx is, just a connecting passageway. Now, what we have to start thinking about then is, all right, so how do we basically get air down into the trachea and then food and water down into the esophagus and basically not have them going in the wrong directions? Now, so that's one thing we have to start thinking about coming up here. And this is another really, really important thing that you have to pay attention to is the location of the trachea. The trachea is anterior to the esophagus. Okay, so here's your trachea. Here is your esophagus. I'm not going to talk about this yet in this video. I'm just going to bring this up now just so I just put that thought in your mind. So remember, the trachea is in front of the esophagus, and then posterior to the esophagus is your spinal column or your vertebral column. All right. Like I said, there's a lot of clinical importance to knowing and understanding that. Okay. So let's talk about the larynx then. So basically, the larynx essentially begins at so we've got the hyoid bone here in your throat, which you can palpate that. Put your fingers on your Adam's apple and just go just a hair up. You'll feel that horseshoe shape, kind of spiny horseshoe shaped bone there. That essentially is your hyoid bone. And then basically connecting, and basically if you go down a little lower, you've got the thyroid cartilage here. That's what this is right here, the thyroid cartilage. Okay. And the thyroid cartilage basically is what we refer to as your Adam's apple. The big bulkier part in your throat, and you know that Adam's apples tend to be, that part of your throat tends to be a lot bigger in males than females. Males tend to have a larger larynx, yeah. So basically, we've got that, and then there's this tissue in between. This is called the thyrohyoid membrane. Some of these words I can't stand saying. The thyrohyoid membrane. This kind of soft connective tissue that connects the two together, because that's all the larynx really is. It's basically just cartilage. Most of it's hyaline cartilage, with the exception of the epiglottis. It's very soft, kind of more elastic cartilage. But it's all it is. It's just about 9 different pieces of cartilage that are all connected together by ligaments and muscles. All right. And so that's something to think about. Now, this one here, this is a very important piece of cartilage here. This is called your cricoid cartilage. Cricoid cartilage. This is the end of the larynx and the beginning of the trachea. So basically, the cricoid cartilage, this essentially is the lowest part of the upper division of your respiratory system. Because remember, the upper division of your respiratory system consists of your nose, your pharynx, and your larynx. All right, and from the cricoid cartilage down, now we basically have the lower divisions, your trachea, your bronchi, and your lungs. All right, so that's kind of something to keep in mind there. All right. Now, and like I said, it's really not important that you. I mean, depending on who's teaching you this stuff, that you memorize every last piece of cartilage in here and whatnot. I mean, like I said, there's a few that are really important. Like I said, the thyroid cartilage. Basically the cricoid cartilage, because that's essentially where the upper division of your respiratory system ends. Knowing that that this extends from the hyoid bone down to the cricoid cartilage. The larynx itself really isn't that long anyway. From the hyoid bone down to the cricoid cartilage, it basically extends from about your C4 to C6, your fourth cervical vertebrae to your sixth cervical vertebrae, which is only just a couple of inches. So it's not that big. However, one of the key functional aspects of this is I put the same picture on here twice. Basically, one of the key functions of this is phonation, or basically turning air into sound, and that essentially is what we use vocal cords for. Now, basically, this is the superior aspect of the this is the superior or upper aspect of the glottis, or of the larynx, called the glottis. Sorry. Now, basically, here, this is what we would refer to as your true vocal cords. Okay, these bands of tissue here, we would call those your true vocal cords. And then here, these are kind of soft flaps of tissue that we call on each side that we would call the ventricular folds, which are referred to as your false cords, or more specifically, your false vocal cords. All right. I forgot to mention that those true cords are called the vocal folds. Okay. So now, basically, let's talk about a couple things related to the glottis. So as you can see here, the glottis can open and close. There are various muscles that we can contract. Because basically, there are various muscles that we can contract to yank on various cartilage, basically on the posterior aspect of the, excuse me, of the glottis here. Sorry, we've got there are some pieces of cartilage that are called the arytenoid cartilages, and there are muscles that essentially contract and pull on those cartilages and pull your vocal cord shut. All right, and basically, if we yank these cords shut, now as you can see, there essentially isn't going to be any airflow into or out of the larynx itself. All right, and now that's important. For example, when you cough, because think about coughing for a second. Let's say you breathe in a bunch of irritants, you breathe in a bunch of junk. All right, and you need to cough. Think about the timing of when you cough. You start coughing, so you take a breath in, and then when you neurologically trigger, the coughing reflex, it's always right at the tail end of an inhalation, or when you breathe in, that glottis is going to slam shut for a second, and then as you want to exhale, as your lungs want to compress and push air out, that air is going to get forced up against this glottis, and then when this snaps open, that air is going to get blasted out, and if there's any debris or junk that was, that you're trying to cough out, that's going to come flying out, or hopefully come flying out with it. All right, so that's important for initiating coughing. And then when it comes to basically phonation, creating sounds, basically what happens, there are various muscles that we contract to tighten or relax and loosen these cords. And basically these cords are going to vibrate. And based on the position, basically how open or closed this glottis is, the positioning of the glottis and the amount of tension on these cords, that will essentially help us determine the depth or pitch of the sounds that we're making. All right. This makes me think about an episode of South Park. I can't remember what season it was in. It was towards the kind of like season, was it 11 or 12 maybe, where Britney Spears, where the paparazzi was going after Britney Spears, and she couldn't take it anymore, and she blew the top half of her head off. And of course, it's fictional; it's a cartoon, so she was still alive. So basically, from her her maxilla on up, or basically the only thing left of her head was her mandible and her tongue. Now, picture that for a second. If that much of your head is missing, you're not going to be able to, or even any part of the upper part of your head, you're not going to be able to actually create language or understandable audible noises. That's essentially what language is. Basically, what happens when we tighten or loosen these vocal folds, and as air hits them, that air is going to become compressed, and that air is going to vibrate. That air is going to vibrate. Okay, and basically, what you're going to hear, if you took a stethoscope and just placed it up against your larynx, all you're going to hear these bzz, 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 you're just going to hear buzzing sounds. That's all you're going to hear. You're just going to hear buzzing sounds. All right, and basically those buzzing sounds then travel up, up through your mouth. And your mouth is what creates language. Okay, obviously your mouth and your brain, but basically the way you position your mouth, the way you position your tongue, the way you move your tongue around, that essentially is how you create audible language. Now let's think about that for a second. Regardless of your race or culture, what part of the world you came from, every larynx operates like this. I mean, that's what's kind of interesting. I mean, we can train that, we can exercise the muscles of our larynx to basically create very deep sounds or high pitched sounds. Singers train. Basically singers do this all the time. But regardless of race, ethnicity, culture, what part of the world you're coming from, the glottis. Basically these vocal cords and the glottis operate the same. And think about that. So this operates the same, but think about how diverse language is amongst the human species. That's kind of fascinating if you really think about it. All the diverse ways that we use to communicate, but yet this structure operates essentially the same. All right. Obviously, like I said, we can train our vocal cords to make more intense noises, but essentially, I don't know. Like I said, I just personally think that's kind of a fascinating thing if you really think about it. So, but that essentially is the glottis and how that works. Now, what we have to talk about next then is how do we prevent food and materials from going down into the basically into the trachea, and that's where this structure comes in right here. This big flap of tissue, this soft cartilage. This is what is called the epiglottis. Epi meaning above, glottis, basically. So we're saying this piece of cartilage is above the glottis. Okay. Now, take your finger. You know where your thyroid cartilage is, your Adam's apple. Take your finger, put it on your Adam's apple, your thyroid cartilage, and swallow. Okay. And think about what just happened there. Think about what just happened. So you put your finger on your epiglottis and you swallow. Now, remember, we haven't gotten to the anatomy of the digestive system yet. But remember that basically that your tongue is essentially, via through ligaments and various muscles, is essentially connected to your hyoid bone, attached to your hyoid bone. And remember, the hyoid bone basically is where the laryngeal pharynx essentially begins, and that's the upper part of the pharynx. Now, excuse me, when you swallow food or water, what you do, think about the position of your tongue when you swallow. Right? What you do is you take your tongue and you ball it up in the back of your mouth. Now, remember, your tongue is a muscle. What kind of muscle is it? If anyone says cardiac muscle, there needs to be a check, because there's only one place where cardiac muscle is located. Now, it's not smooth muscle because we have voluntary control over it. The tongue is skeletal muscle because we can, like I said, we can voluntarily control it. All right. So when that tongue balls up on the back of your mouth like that, what it's doing is it's contracting. Remember, the word contract means to shorten, right? And when the tongue contracts, it yanks up on the hyoid bone, thus pulling up on the larynx. All right, it's literally pulling the larynx upward. And basically, what's happening as the larynx is being pulled upward, the glottis is essentially being pulled into the epiglottis. So basically, the epiglottis basically covers the glottis when we're swallowing. Okay, when we swallow food. So basically, by doing that, then that means that food, it passes right over the top of the epiglottis, passes right over the top of this cartilage, and then passes down into the esophagus. Okay, now that's something to think about here because And remember, I said at the beginning, I think it was the beginning of this video or the end of the last one, I can't remember, that the basically the larynx and the trachea are anterior to the esophagus. They're in front of it. Okay, they're in front of it. Now, that's important to remember because let's think about this for a sec. Like if a patient's being intubated, remember when a patient is intubated, when you're intubating the patient, you're sticking a tube down their throat, or you're sticking a tube in them so you can ventilate them, so they can you can get air into them. Well, because when you intubate somebody, basically there's you take a light and an object, I can't remember the name of it, that looks like a shoehorn essentially. You place it in their mouth, and it's kind of that object is kind of curved like so. So you kind of pull the mouth open, and then you run a tube down in there, and there's gonna be a wire in the middle of that tube to make it a little stiff, so you can kind of get it into the hole easily, and then basically you put the tube in. There's a piece that's connected to the tube. You pull out, the wire comes out, you connect a bag to it, and then you just start moving air in and out. Now, well, there's a chance of making a mistake, and let's say you intubated their esophagus instead of their trachea. Well, you can probably do the math here, and what the problem is going to be is that if you intubate the esophagus, you are going to be blowing air into the stomach and not their lungs, and you could potentially do damage to the stomach. But the worst part of this is an unconscious patient who needs to be ventilated. They're not getting air where it's supposed to go. All right, and obviously, this is easy to figure out if you've done this incorrectly, because their abdomen is going to rise and fall because you're inflating their stomach. All right, whereas if you intubate a person properly, you'll see the chest rise and fall as the lungs slightly fill up with air. All right, so that's something to kind of keep in mind as well. This is something you do to unconscious people because when someone wakes up and they got a tube down their throat, the first thing to do is start coughing and hacking because our airways are incredibly sensitive to large debris or materials from getting in there. The walls are sensitive, so if large objects touch the walls of our airways, we're gonna have this coughing reflex. All right, and that's what happens, when you swallow something too quickly, or whether it's and you have like a breadcrumb or a little drop of water go down into your glottis. Essentially, what's going to happen, through your glottis and into your trachea, that's when you're going to start coughing and hacking for 3, 4, 5 hours. It feels like it afterwards, because you're trying to clear that out of your airway. So basically, only air is really meant to go through here. All right, so that's essentially how we protect ourselves from swallowing objects, into our trachea. Is when we swallow, the epiglottis is pulled into the glottis, covers it, covers this opening, and then food and water pass over it and then go down the esophagus. Okay. Now, actually, now that we're on that topic, let's you know what? Forget it. I'll just end here on this video. Keep it a little shorter, and then I'll talk about the trachea and basically the rest of the anatomy of the respiratory system in the last video.